testosterone as an aphrodisiac, absolutely amazingly known to happen and to be true for so many men, millions of men in the world. No one will argue that testosterone will help men feel more sexual if they have low T. And in America, it's thought to be upwards to 15 million men have low T. Therefore, the symptoms, and this is low T with numbers, low T numbers, laboratory numbers. What I'm interested in presenting to you today with an evidence-based presentation with my articles that I've researched deeply is testosterone replacement and what it does and how it can improve men that have normal testosterone on the labs, yet they experience improved sexual function. This is incredible. And I have a lot of experience in this. As I've worked with thousands of men related to using testosterone, of course, on themselves. They gave it to themselves and they come see me. From testosterone doses, TRT doses, all the way up to massive super physiologic steroid doses. So what do we have to start off this presentation with evidence? UCLA has a journal, a pamphlet they send out to lay people that of course I love to read to stay on top of things. UCLA Health, January 2020, the healthy year as it's called. They talk about, do you need testosterone therapy? Well, here we go. So they say more muscle, better libido, and renewed vitality. These are some of the treatment promises for men and women, interestingly enough, at UCLA. Is the approach right for you? Now, one of the leading expert urologists there at UCLA, who's an MD, PhD, we don't treat a number, he says, we treat a patient. Some men have blood tests showing low testosterone, but are unbothered by symptoms. Other men have low testosterone symptoms, but their numbers may be in a normal range. Every individual's biology is different. There is no one size fits all. UCLA is saying this. I'm happy to see this. I'm happy that we're breaking some barriers. It's interesting that we would compare this to the Endocrine Society recommends TRT for men who have hypogonadism and diagnosed with symptoms, of course, and low levels. So this is discreetly new thinking, and it's very interesting. So UCLA is going ahead and recommending this, and that's novel, and that's avant-garde. And I think the doctors at UCLA are not cowboys. They're not anti-aging doctors. They're basing their findings, I assume, on data. Now, the data on studies of testosterone replacement on normal physiologic men with normal testosterone, looking specifically at sex function, is very limited. Everyone will agree that testosterone therapy improves erectile dysfunction and libido in hypogonadal men. And I present to you my second article for this presentation from doctors at Baylor, and this was 2017 Current Opinion Urology, and their summary is, the available literature supports a role for testosterone treatment in men with low testosterone levels, erectile dysfunction, and low libido, with symptomatic improvement in these men. This is, of course, with treatment. So there's article number 2. You have low T, you're diagnosed, you're treated, the man feels better sexually. When we look at the data in evaluating men that have normal testosterone levels, we assume these are middle-aged men, and they're suffering with sexual symptoms, erectile dysfunction, low libido, Again, I'm teasing this out from the classic mood, lower mood, not mood disorders, but chronic fatigue and things like low energy. So this is just on sexual symptoms. We have an amazing article in Diabetes and Medicine 2018, Testosterone Therapy for Sexual Dysfunction in Men with Type 2 Diabetes, a systematic review and meta-analysis of randomized controlled trials. So here's a bunch of data. Meta-analysis. This is a lot of data together, just generalized data. They're pulling together and looking at what they think is going to be significant data, though, not just by chance. Well-done studies. And now these were men that have diabetes, type 2 diabetes, which is the most common in America and throughout the Western world. Now, in this study, they looked at 611 articles, 6 randomized controlled trials, many, these are hundreds and hundreds, if not several thousand men. And they concluded that testosterone therapy may moderately improve sexual desire and erectile function in men with type 2 diabetes. And they say, of course, there's limitations on that. Now, this study, these are just men with type 2 diabetes. There's no mention of having low testosterone numbers. So we assume these are all men from different ages, from 20s, 40s, 60s, not older men. Most of the studies, if not all the studies with hypogonadism, they're older men. I'm interested in men that are not older. Of course, we care for older men, but this amazing market in this huge number of men that are middle-aged, say 30 to 60, that are taking testosterone, that are interested in testosterone's effects. And it's going to be number one on their sexual function, then mood and energy, and of course in the end, boom, the muscle building stuff. But number one, it's the sexual function. So there's an article, very interesting. No mention that they have low T. Now, the next article, which is the most significant article and directly goes after what I'm looking at, is from 1992. I cannot find an article currently that looks at normal men, middle-aged men, having normal testosterone and the effects of given testosterone. Does it help them feel better sexually? And in this article, Journal of Clinical Endocrinology and Metabolism, the effects of exogenous testosterone on sexuality and mood of normal men. This is it. Could you imagine 1992? Where are the studies? I think you could see that I have some studies to do. So the take-home message of this amazing study, let me brief you on this. Testosterone was given to 31 men. Age ranges 21 to 41. There it is. We're looking at this. They have normal testosterone levels. In this study, they randomized 2 groups. The first group received 200 milligrams of testosterone enanthate weekly, and the length of the study was 8 weeks. The other group, for the first half of the 8 weeks, they received 4 weeks of placebo injections. And then at the last part of the study, which would be the concluding 4 weeks, they received testosterone injections. This is another way of looking at a control arm and then giving the therapeutic arm in that arm and comparing and seeing if there's a difference. They say that the administration of 200 milligrams of testosterone enanthate weekly compared to up to 400 to 500% above testosterone baseline. Let's stop right there and just talk about something I think is really interesting. 1 cc of testosterone enanthate a week, to so many men out there, think that's TRT dose, and for some men it is. In this study, they said that this provided 400 to 500 times higher testosterone levels versus baseline physiologic. That's incredible. And what's really incredible is that so many men that are blasting and cruising are cruising on not 200 a week, but 400 or more a week. This brings my point that you just would have to wonder what are the health consequences of that over years. Back on track here. So in the end, this study's amazing how they talked about details of sexual arousability versus sexual stimulating behavior. What's going on? So they have clinically proven in this study that normal men receiving testosterone injections had increase in sexual arousability. Now, they said that these men were in just a monogamous relationship, that they didn't seem to have increased stimulating sexual activity, which means that you're asking for sex more. They said they just had more sexual arousability, so they thought of sex more, and it seems like the climactic issues and the experience of the sex was better. Now, they compared this to men historically that have low testosterone levels, and those men had increased sexual arousability, and they also had increase in stimulation of sexual activity, so they were knocking on the partner's door more. This is incredible. So that is the evidence that I have showing that men that are normal, without testosterone users, not steroid users, I call these virgins, taking testosterone for up to 8 weeks, they had an increase in sexual thoughts. They had an increase in sexuality. Now, with my data and my experience, my anecdotal experiences with thousands of men, obviously mainly that have used androgens on themselves for muscle building purposes, and these are not professional athletes. These are just regular guys that want to get bigger and stronger and want to enjoy testosterone, or found themselves after using steroids, they had to stay on testosterone, which I always talk about. That's number one risk of testosterone. If you use it or any steroids, you may be on testosterone, blasting and cruising, or just cruising for life. It's always my first risk. So my data it's anecdotal, but I have so much of it that I've seen so many men come to me that are mid-20s to mid-40s, just like this study. They've had baseline testosterone levels that were normal, 400 to even 600, and free testosterones that were either normal or maybe low 25 percentile. Because most of these men, it's sometime before they administered testosterone to themselves, they did have it checked. And they then subsequently come to me because they're enjoying testosterone and they want to be managed well by me from my experience, so they have less side effects, obviously cardiovascular side effects and all the deadly potential side effects. So they come to me. Those men have come to me. There's so many of them that have come to me, and I always, in the beginning, years ago when I started, was amazed at looking at how steroids and men using testosterone, what was going on. I would say, so you had normal testosterone, you gave yourself testosterone, yes, I did, doctor. Okay, and how did you feel? Oh, man, I felt much more horny, too horny. It's, doc, it can be a bad thing, for us men sometimes. You're too horny, it's not always good, obviously. Got to be careful. And how do you feel now, sir? And this is 2 years later, 10 years later, even greater than 10 years later. These men are still sexually happy and satisfied. This needs to be studied, and this is absolutely amazing. Now, men watching this, please comment. I love to do these videos and then to see these comments. It's so relevant and important that this open channel is for men and other men looking to learn, as everyone's looking at the research, looking at this, to make their decision for themselves. Is testosterone for you? Understanding there's going to be good things potentially, and there's going to be risks. So this is anecdotal information. We need more studies. You definitely can see that I'm interested in conducting a study looking at normal men that are suffering sexually. And there's so much background. I have to go into depression. I have to go into their history of emotional abuse, not to mention physical or sexual abuse. You have to look at their jobs, look at the stress, circadian rhythms. Men that work like policemen and firemen and nighttime workers, they have low T or symptoms because they're tired. There's so much stress in our world. You can't just give a man testosterone without really working him up. And then of course you have to look at the numbers, and you have to try to reverse anything you can easily, or not easily, but just try to reverse any medical issue you can, so you don't have to just give him testosterone, because there's going to be side effects on that. Some of the side effects are deadly. That's what I'm trying to teach. But if you enjoy testosterone and it works and it ameliorates a man's sexual function and he had nothing else wrong, how can we look at this? We have to pay attention to this and do more studies. So I'll always say to you, consider the risks. Testosterone for most men, even with normal testosterone levels, based on the literature, it looks like it is an aphrodisiac. But is it worth it? Are you ready to start? So many men, trust me, in these consultations, I do them 2 or 3 a day, sometimes even more consultations, telemedicine, digitally, all over the world. Thank you so much. Right now, it's a beautiful time using telemedicine. And so many men, they're not ready to start testosterone, and they ask me, and we work through it. We roll the sleeves up and we work through their numbers, their histories, such incredible, confidential, intimate details that you're trusting me with when we're talking on our Zoom, on our digital medicine, telemedicine platform. You're telling me things, and I'm in a room, I'm creating a soundproof room so we could listen and we could yell and talk at each other and get into it, so I could help you work through it. Do you start testosterone? Do you do it? Is it worth it? What are the risks for you? What is the crystal ball? Can I get that for you? So number one risk is, if you start testosterone because it's going to be potentially worth it for your sex drive, look at your risks. You'll be on it forever, potentially. Are you ready for that? Are you 23, 25, 26? Are you ready for that? Fertility? The other side effects, hair loss, puffiness, acne, gynecomastia. I'm not saying it's not important. Cardiovascular implications. You can see my videos. Hypertension, coronary artery disease, polycythemia, prostate, enlarging a prostate. If you had prostate cancer when you started taking testosterone, could it further grow that prostate cancer? It certainly can. Not to mention BPH and prostatitis. This is all I do. It's super complicated. It's full-time, requires testosteronology. It is amazing. And the last piece is mood. If you take testosterone, could it make your mood well, or will you become anxious? I told you, men end up in the emergency room with panic attacks, even on teeny amounts of testosterone, because they have an anxiety issue underlying. There's so much to consider. Thank you so much for watching this video and sharing it, and please thank you so much for trusting me, and please let's get all the comments going. Thank you so much. I really hope this video helps men in the world decide, is testosterone right for you or not?